welcome to today's Medical Alley webinar titled Implementing AI-Driven Solutions to Transform the Patient Experience and Operational Efficiency. This is presented by MentorMate. I'm Ben Wagner. I'm the Associate Director of Communications here at Medical Alley and will be your host for today's session. Really delighted to be with you and to jump into this really important topic and to take some of your questions here as well. Before we get started here too, I do want to offer a big thank you to MentorMate for their continued partnership and their support. MentorMate is a global organization specializing in strategy, in design, and in custom software development. Deep expertise in healthcare. They really help organizations harness the power of emerging technologies like AI to solve complex challenges, of course, to improve patient outcomes and to drive operational efficiency. So if you've been to a bigger Medical Alley event, you've likely seen MentorMate or their team, and we are really proud to keep building on this trusted partnership and this relationship here today. With that, I'm really excited to be joined by our two outstanding panelists here today who do bring deep experience and insight into how AI is being used to drive meaningful change in healthcare. So with us is Josh Marquart, the head of healthcare for the Americas at MentorMate, where he helps healthcare organizations build custom scalable solutions using the latest in digital innovation. Also with us is Kolby Kolbet, the Chief Innovation Officer at LifeLink3, where he is leading the charge on transformative tech that improves both patient care and operational outcomes. Today, we'll dive a little bit deeper into how AI is being applied to improve patient engagement, streamline operations, and tackle some of the industry's toughest challenges, from staffing to workflow automation, and then also bringing in some topics around privacy and regulation here as well. Josh, Kolby, welcome. Before we get started here, why don't we have each of you take a minute to introduce yourselves, and Josh, I'll start with you.
Great. Thanks a lot, Ben. As you mentioned, we've been a partner with Medical Alley for quite a while, and it's always been educational for us, and hopefully sharing our experiences educational for others, but it's been a great partnership over the years. MentorMate is based in Minneapolis, but we're a global organization with delivery centers in India, the Nordics, Eastern Europe, and LATAM. So basically 24-hour coverage, and our fit here is really around custom software, and that goes from payer to provider to medical device. We've been involved with a lot of very large companies around town here in Minneapolis, as well as across the globe. I lead the Americas market, and very excited to partner here with Kolby on the conversation.
Great. Thank you, Josh. And Kolby, I'll turn it over to you.
Yeah, thanks, Ben. I'm Kolby Kolbet, Chief Innovation Officer at LifeLink3, like you said. LifeLink3 is an air ambulance service that offers helicopter and airplane transport, and we have 12 locations throughout Minnesota and Wisconsin. And we've been members of Medical Alley now for, I think, just over 5 years, and it's been a great opportunity for us to connect. That's where Josh and I met at one of the first morning meetings in Golden Valley, right at the office, which was a great. I mean, it kicked off a relationship for us to start talking more about AI. And I was a chief clinical officer for 12 years at LifeLink, and so I just recently made the transition to the innovation role after seeing what the opportunities we had in front of us for AI, not only in the clinical setting, but in the operational setting, revenue cycle. And so LifeLink was an early adopter of the role of Chief Innovation Officer. So we celebrate that, and looking forward to the discussion.
Great. Well, we appreciate the both of you for being here. And I really want to start here by kind of setting the stage. And Josh, I'll start with you. In your experience leading digital health strategy, what do you see really as distinguishing factors for organizations that are using AI effectively from those who may be just kind of dipping their toes in the water? What mindset do you think, or what approach really sets those innovators apart?
Yeah, sure. We do see a lot of different clients across the globe in this. And when we see the ones that are most successful, it's really focusing on what is the care challenge or what is the business problem, depending on where you fit into the healthcare ecosystem, that's going to make the difference. It's really easy to get caught in the hype of AI, just like everybody was in the hype of, I need an app for that. probably too many decades ago than I want to admit being part of. But if you can focus it around a business problem, it becomes much more tangible, and you can have actual results that that don't get caught up in lack of adoption or poor outcomes, because it starts with the end in mind. I'd say the other one, and it might be less obvious, is lateral thinking. So we often come in where there's a very specific problem, or we've already got a solution, or the company always has a solution in mind, but that might not be the right place. So by examining where the friction points are is really where you can find out where to apply it. Besides that, you do need strong technical partners. There just aren't enough people who have hands-on experience with this technology, and probably more that have had a bad experience than a good one. So finding your partners, working through the risk, and change management is critical.
Kolby, what do you, turning to you and kind of in a unique position here with LifeLink 3, what motivated your organization to begin implementing AI solutions? And maybe I wonder if you could take us through kind of that early vision that set you off on this course.
Yeah, there's a couple items that really were the impetus for looking at anything artificial intelligence that could augment our workflows. Revenue cycle management was one of them. We're subject to the No Surprises Act, being an air ambulance, so that created a lot of administrative burden, preparing and doing a lot of that administrative task work on top of our already task saturated billing team. So we wanted to find ways to streamline that, and I just had happened to be going through a lot of just independent learning about AI. It was mostly around marketing and salesy type stuff, but I learned about prompt engineering and how important that was, and found that I was able to apply it in a HIPAA compliant GPT platform that we utilized called Bastion GPT. And it really took the burden off of how can we do this and protect protected health information, and do it with confidence. So that was on the revenue cycle side. But more interesting for the clinical folks is our crews usually spend 60 to 90 minutes with a patient at most on the helicopter, or the entire patient contact, and that required a minimum of 2 hours of charting time. So post transport, their day's just beginning, and we're using so much documentation to satisfy a lot of different requirements, whether it's the state or national standards. And then we have quality data we want to gather, and continuous quality improvement stuff. And then, there's things we're just curious about, whether we're doing, outcomes on a particular device that we've been trialing. So the focus was on how do we make documentation more simple. And I had started to see a lot in the literature about ambient AI in the clinics, and I had a cold call from a company about an ambient technology, and I basically said, we're not a clinic, but if you can make it work in our environment, we're all ears. And so we worked together with Playback Health on that. And it was interesting because we're in an austere environment, so it's not a sterile, quiet, one-on-one provider with a patient. So we're working still through the technology of using an app on a phone, but being able to streamline and not add any burden to the staff to be able to transition in and out of an aircraft and in and out of a hospital without interruption of capturing that. So we've been using it in simulation to make sure that the documentation is coming across accurately, and that the staff gains comfort knowing that someone's listening and someone's documenting everything I say, and that's uncomfortable for some people, not knowing where that goes and how it's utilized. And so then also we had to work with a third party to that quality data platform that we use currently to process that information, pull that information over into usable templates that makes that transcript meaningful and applicable to what we do each day. So since then, there's been a lot of other AI workflows to extract information from our clinical documentation. and pull out quality elements and identify things like ICD-10 codes and our quality metrics, if they were applicable and met or not met, just at a glance, where that would otherwise take, several weeks of several people reviewing information manually and ensuring that, cleaning the data to make sure it's accurate. So that's been our main focus, has been revenue cycle and clinical practice.
And Kolby, you're in a really unique position with being an air transport organization. When you think about maybe not only the patient journey, but also the provider experience, which you mentioned reducing some of those clinical burdens as well, where do you really see AI starting to move the needle? I guess, you mentioned some of that ambient learning technology that you've implemented, but are there any moments really or touch points that you've seen early on that have made a noticeable difference?
Yeah, one thing that has been, it's the best line ever from RJ Frasconi, who's been a long time, one of the early medical directors for LifeLink 3 for over, I think, 37 years, and Regions hospital EMS physician and ER physician. He said in EMS we don't know what time it is, and by that, once the tones drop and you're set into motion, moving towards the patient, you're just focused on doing, patient care and through preparation. And then, when you're on scene and, you're taking in all kinds of information at once, but your focus is always on the patient. And, sometimes folks will write down stuff on a glove or on a piece of tape on their leg, trying to keep a sequence of events. And at the end of the transport scenario, they'll pull their data from the cardiac monitor, and that captures every 15 minutes, every 5-minute vital signs, and typically that's your landmarks. And sometimes they can push a key on there that indicates a certain procedure was done, and you work backwards from that, from the time that you were on scene till the time that the cardiac monitor was applied, and then you kind of remember, well, about a minute before that I did this. And so now we thought, if the crew can just do their work, focus on the patient 100%, and not have to worry about trying to be a scribe at the same time, or writing on the glove that you're going to pull off and throw away, and forget that you threw it away without getting the information you wanted off of it. And so the provider, it's one of the largest sources of burnout is the unnecessary administrative burden, and truly getting clinical folks to be able to work at the top of their license and do more of what they enjoy, and spend less time on the not so fun, monotonous work, and trying to piece things together.
Josh, as you look from your perspective, how do you see AI helping healthcare organizations better connect with patients? I guess, what's exciting you in this space?
Well, I think Kolby hit it pretty good on what he was saying. The biggest thing that I see is that we actually get to talk to our doctor instead of watching them click and type and giving us a demonstration of that. In my personal life, when I tell people what I do and I talk about those systems and they ask, what is that? Well, if you go to the doctor and see Epic and your doctor's typing, or the nurse, that's what they're doing. But when you flip that with the ambient AI, the doctors get to practice what they got into medicine to do, all right? And the patients get to get the focus and attention that they need. So it's more about what they no longer have to do, or have to do less of, into what could they do and what might they be missing. To Kolby's point, if I don't have the time to ask the right questions and probe, because I have to get to my next visit and do 2 hours of documentation and charting, it really interferes with the level of care for people. The other thing I would say is finding and navigating. So if you flip that over from a patient to a payer, finding the care you need, determining whether it's covered. There's all kinds of tools for that today, but it's not very, I guess I'd say, smart or aware of the context of your situation. If I have a condition and the system already knows that, it can navigate me much better to what I need. I'll be happier. I'll get the care that I need sooner. And that's easily measurable by looking at where a person starts and how how you navigate them to where they need and whether that got them what they need to move forward. So those are a couple areas where I think of a patient or even a provider could get a lot of value in talking back and forth with the patient. And it only gets better from there because the AI can start prompting, ask this, what about that? And doctors usually have a much better memory than I do, but nobody can know everything. So having your trusted AI with you, and that's the key word, trusted. Kolby, you mentioned that, getting the people comfortable with what they're getting is a huge component of that. So those are a couple of areas, Ben, where I'd say I see much better connection.
And I do want to talk about privacy and that kind of trust relationship with this new technology in here just a minute. But I also want to go back to something you mentioned a minute ago, Josh, which is kind of those metrics that you're measuring for to evaluate success. Are there any others? You mentioned the payer experience there.
Yep.
Are there any other metrics that you see as valuable in determining whether AI implementation is being successat?
Yeah, I think that's going to come out of the business problem, like I mentioned above. Like, what are you trying to solve? There's always NPS scores or CSAT type scores with your providers, patients, and even back office folks. But at the end of the day, are they completing their tasks faster, more accurately? Is the patient getting the care that they need sooner? And how many different treatments were tried before they got to the right one? But then there's also real tactical ones where somebody's trying to understand their benefits. And there's usually any number of FAQs and searches that they could do. But if they could just ask the darn question, they might get the answer. And that's some of the pieces that we look for. Are they using that? And that could be a design piece. Like, do they know where it is? Do they trust it? And it could also be an output piece. If we're sending back an answer to a question they didn't ask, that could be damaging as far as that trust relationship that you mentioned.
Kolby,
yeah, I would just add that, AI is not perfect. And that's one thing that we noticed in our simulation. And we wanted to be, really transparent with our staff that this isn't an end all be all solution. When we fully implement it, it still requires the human in the loop, to review the things. And, we've had some comical outputs, and, we give a medication called TXA when someone's bleeding in it heard THC. And, so if that went through in the chart without being mitigated, that'd be embarrassing. And so that's part of the reason that this is a, crawl, walk, run type scenario. And at first, I just thought there was going to be an opportunity to bring in some big enterprise-wide AI where everyone would have access to it and everyone would be, involved, and everything would be on-prem and, safe that way. And, vetting your partners is very important as far as how that data is stored and moved around. And then developing internal policies about retention of that data and how it's utilized and what is really marked as QA data, for discoverability purposes. And one of the items that we really wanted to get through is not just to have the actual transcript there, but the summary, and the summary being in a format that flows for the crew member to review, but then still allow them to tell their own story, not having the whole transcript there to kind of pilfer through and figure out who said what. And, so there still is some responsibility on the provider, but this general structure of the documentation should be there in the format that you need it. And then, a policy around AI usage in the organization, no matter what the application is. And that's a behemoth. It's a big document when you talk about what platforms can be utilized and for what purposes and who can use it. And, what are the uses that you can't use and what data can you use and not use, like, even personal information to try to protect your staff from exposing themselves out there for putting, their own sensitive information out there. But there are a lot of good, every day or every hour, I should say, there's a new startup doing something to protect data, move data, verify that your data is not leaving your organization. And so some items that we used we use Copilot, for our administration, and getting comfortable with that is, it seems like it's there, use it. And the AI literacy within an organization, it's a big uplift to empower people, but they need to be upskilled and given, some knowledge that they've never even knew existed before. And now try to teach them things like prompt engineering and make them think differently, where you truly have not just asking the question, what does, or how can I? It's truly setting up so it's a thinking partner to go back and forth with and bounce things off of.
Kolby, there's actually a question that's come in here from the audience here, and this is a good time to remind everybody here. Feel free to put your questions in at any time in that Q&A box. And but the question is something you mentioned a little bit ago, that example, the transport example regarding chronological documentation with cardiac data. The question is, are the AI systems creating chronological records of care given based on voice recognition or visual camera captures?
Yeah, so we do not use visual camera captures, but you do see that in police cameras, how they have the date and time on there. And
sure,
most of these documentation platforms do not have that, but that was an absolute, that's our absolute before we roll it out, is it's got to have that function. So it's just in beta testing right now to have the timestamps. And, all that stuff is great, but if something is there and it's a prolonged sequence of events, it's nice to know that periodically there's a timestamp next to something that was said. One of that is who said what. And for our staff, we'll be able to train voice recognition or voice signature. And that'll also be, that's kind of why we slowed our progression, because we can roll this thing out in a way that it's prime time ready to go versus rolling something out that we know we're continually developing and losing adoption or, the confidence in the staff to utilize it. So the voice signature would be a great add, so at least what your own crew member said versus what someone, on scene or in a hospital had said or asked. But yeah, that's the absolute must. And that was a good question. Thank you.
Yeah, absolutely. And thank you for the question as well, too. So we talked a little bit about some of the ways that AI is streamlining operational efficiency in each of your organizations. But Josh, you're working with a lot of companies that are trying to modernize their operations. I wonder, where do you see maybe the biggest opportunity for further growth? Really, where do you see maybe the most untapped potential in the utilization of AI to streamline operations?
Yeah, one example comes to mind, and I think it'd be applicable to a number of scenarios, but it's really around stratification and then prioritization. So one of them is, I think everybody here has probably had a spouse or partner say, hey, you should get that mole looked at. And then had to try to get into a dermatologist, which takes forever. But there are apps out there where you can take a picture of it and it uses AI to analyze, red, yellow, green, for lack of a better term, and then put dermatologists in to review that without having to schedule this office visit. Now, that hits on a number of levels, and you can use it for other potential conditions as well. But what a fantastic way to let our dermatologist practice at the top of their license. How do we ensure that we don't have all these visits that don't make sense? And you still want, to Kolby's point, a human in the loop. But at least then they're prioritized to where they need to go. It could also help with your billing RCM type activity, because you're churning through those a lot faster and more efficiently than you would with a doctor or an office visit. So that's one immediate place. And beyond the mole that my partner wants me to go have looked at, there's other conditions, other pieces, even taking pictures of your EKG and making conclusions from there, which completely erases any integration activity because it's just a picture just as well. So it's really novel ways to change, to be a sea change. Another area that I think will have a lot of change, but I don't yet know how it'll play out, is what I call the robot war. We have AI that's sitting there handling prior auths and denials, and we're starting to see AI that's submitting in order to get past those denials. And so you basically have two AIs battling it out with each other. And so it'll be interesting to see how that robot war escalates, or whether it resolves into something that's far more efficient across payers and providers. But I do think there's a lot of similar opportunity to take the tasks that are most difficult, most time consuming, and most personalized, and at least get them on the fast track.
Kolby, you mentioned some of the ways that you're already utilizing AI to streamline your operations, to reduce the burden on your clinicians and your providers. Where do you see maybe some opportunities for innovation within LifeLink, and then maybe broader in the healthcare industry?
Yeah, I'll start with, our intake when our phone rings, and oftentimes it's pretty straightforward for us, right? We send the closest helicopter and we know where all of our aircraft are, and our based on the patient's needs, whether it's an airplane or a helicopter. Some of that could be determined, but oftentimes, communication specialists are not necessarily clinically trained. And so AI could be there listening and basically just recommending, this aircraft, and it can also, I would see it assessing, weather and things like that and making recommendations. We have staff that do that right now. And it's never to replace staff. It's always to augment and be another tool. Like Josh mentioned with the mole, they basically go into two boxes, right? Like suspicious or not suspicious. And of course, you want to assess the suspicious ones first. So it speeds up the process. And, there's always the opportunity that something can get missed. So, that's why someone still needs to review them. But using AI to basically pick up the bulk of the work and, shift through there. On the clinical side, predictive analytics is where we want to get to. And in the health setting, in the healthcare setting, in the hospitals, there's a lot more data, and that's, they're building on these models daily, and those models are already predicting early signs of sepsis, and they're able to intervene before, there's so much data that's being correlated that a human wouldn't be able to do independently. And that's data on patients that have been diagnosed with sepsis in the past, and it takes all of their aggregate data and looks for these obscure connections, that the most obscure items that can predict it in the future patients. And so that's obviously a big cost savings to healthcare, but it's a big expense to take this on. And right now, adopting too much too early, is I would say not recommended. Finding, a application for a purpose is the most important right now. And then for Josh mentioned, you mentioned, if there's a patient condition, did you think about this, right? Almost like a differential diagnosis robot. And oftentimes making sure that we don't just get tunnel vision and, we fall victim to our own biases or confirmation bias where, it's chest pain and they're sweating and they were shoveling, so it's got to be a heart attack, right? It could be something completely different, but we just see something and immediately respond and act on that. And so that's where AI can be your safety net a little bit. And then also high risk medications. And, in I think as University of Washington, their anesthesia department was working on identifying vials that were being drawn up and in the syringes, the labels on the syringes to ensure they match. And, it would offer a visual or audible signal if there was a mismatch in the medications they were drawing up. And also for the wasting of medication to determine the amounts and what vial they were coming from and who was doing the wasting. So obviously a big safety factor there as well. And then just on the administrative side, there's, you're at your desk and you're thinking things through, you're preparing a presentation or executive summary, or you're trying to pitch an initiative to your team. And, we just went through an exercise as a leadership team yesterday, and we were able to talk through differential thinking, thinking with different perspectives. We use the DISC methodology a lot to determine our personality types and how we think and do our work and what we need to be satisfied with a presentation, let's say. And you can do this all by yourself without having to talk to anybody. You can ask the chat GPT or anything, Copilot, serve as, I want you to respond to my proposal attached and think about it. How am I going to need to present this so it lands well with someone that's a D, an I, an S, and a C? And what did I not think about, or what questions do you have based on this? So you're basically running through scenarios so you can have a foolproof plan essentially when you're done, and think through most of the challenges. You can even ask it to play the role of the CFO, or someone that is really resistant to technology or change, and how you're going to gain their buy-in. So it just needs to be thought of as a tool or a consultant, and you get to assign the role and tell them what they're good at, and they'll hopefully respond that way. Other things too is just like, how do I know it's right? Is it just an opinion? And I mean, essentially, ChatGPT was a word predictor, and based on all the data, it would just try to generate the next word. And now, you can ask it for, provide references, and so it'll create the reference list. And the human in the loop, I do this a lot with, following those, searching those resources to make sure they exist, because it will hallucinate sometimes and make things up. And I've had that happen before, where I look for a very specific evidence-based practice for something like, a pediatric pelvic injury, and it will create an article that says, pediatric pelvic injuries and that latest evidence, and it gives the journal, the volume, and the issue, and it doesn't exist. And so that's getting better, but you need to also fact check, your responses, and make sure that that you follow through and protect yourself.
I think that's really good advice, and I've had some of those instances too, where a GPT has made something up entirely, and you have to, and you're like, I'm really glad I caught that, because that would have looked really bad had I sent that out to a sort of a public audience. So, on that topic of trust, Josh, I had a conversation with one of your colleagues recently about the relationship and the stages of the relationship that we're in with AI, where there's a lot of excitement, of course, but some uncertainty too around how to build it responsibly and sustainably. I wonder, how do you think about building trust into AI systems really right from the start, especially when you think about privacy, about some of the things we've also talked about bias, and then, of course, being in healthcare, staying on the right side of regulation?
Yeah, absolutely. When we go at MentorMate, when we go after AI in the health space, the number one piece that we're doing is design led. If you're not getting the hearts and minds of the people that will use it, it'll never roll out. And I've seen a number where, yes, this AI could save millions of dollars if we deploy it to everything. But the fact of the matter is, the people making those decisions don't trust it, because they can't see it. And as Kolby mentioned, until you can cite chapter and verse multiple times. So I would just encourage, be pragmatic about the rollout. Build on a small success and just keep lather, rinse, repeat, as my shampoo says, and grow it. From a risk perspective, early on, we saw a lot of companies just say no. No ChatGPT is allowed at this company. And it was really kind of like putting your head in the sand. And what we've developed is more of a risk-based model. And it depends on what you're using it for, what are the impacts that could come out of that, but it enables you to adjust and adapt on the fly to an increasingly fast innovation level. And gets people on board when you say to, a business partner, we want to implement this, we're going to do a phased rollout, you'll get reports along the way, and manage basically the change management component of it, especially since you can go to them and say, we evaluated the risk, we evaluated the compliance components, and this is what it looks like. Here's the profile. A lawyer would understand what we're going at versus jumping right in with LLMs or other kinds of models that just aren't going to resonate with that audience. And I love Kolby's example of changing what you have to the right audience using AI that speeds it up. So when I think about those perspectives, FDA regulations are certainly different than back office regulations. They all have HIPAA. And to what Kolby was saying, like, let's keep the data inside so that we don't break our obligations and commitments, but at the same time, let's let the data out where it needs to go out and stay integrated. I think of my partner having chronic pain and coordinating that across multiple providers. Everyone wants the history. Everyone, did you try this? Yes, I tried that. And that's mostly on the patient to coordinate that because it's so complex. Well, AI can do that and share in the right places in order to get you the appointments, the information to the providers, and simplify that process. It's still pretty nascent in that area, but if you have a risk-based framework, you're going to have a lot better luck evaluating and implementing than a simple, roundtable saying yes or no, because the answer is not that simple.
Josh, you mentioned something too that I thought was interesting about how, the prevailing thought initially was just say no to like ChatGPT and other things like that. I wonder at this point, though, is there a cost of inaction, of not
Absolutely
moving forward? And I wonder, what do you think that might be?
The cost is, as far as I can see and what we've experienced, is everybody's going to get left behind, and the level of efficiency and care that organizations are going to have by adopting is going to be a factor of magnitude better. And so if people are not adopting it or experimenting with it and getting trained on how and how not to use it, they're essentially going to become dinosaurs. There's really no other way that I can state how important it is to stay on top of this. And it brings in a whole new set of challenges. But that's kind of why we're here, is to help solve that. Kolby, you've been solving a ton of them at LifeLink 3. It's a little bit uncharted ground. It can be scary, it can feel risky, but we need to lean into it and learn from each other.
Kolby, as you've navigated some of those concerns in rolling out AI systems in your organization, what have been some of the lessons you've learned, and really how do you keep kind of moving forward with the knowledge that there is some levels of risk in trying these new technologies?
Yeah, I think it's twofold. One of them is, having the assumption that everyone's as versed and aware of the applications as someone that's passionate like me about it. And so, discovering, taking into account, surveying the staff to see what their level of knowledge is and what's their comfort level, and their, how much do they believe in this, or how much do they just want nothing to do with it. And I think back to when the internet first came out, and my dad said that this is going to be the ruination of the world. And we were one of the first to get 14.4 dial-up back then. And, and it became, it's a way of life, right? So I consider this the next version of the rollout of the internet. And so there is a big cost in action. And so there's other air ambulance organizations out there, some quite large ones, in fact, and some of them just have taken the stance, absolutely no access to anything artificial intelligence, generative AI, and they blacklisted them on the websites. And they're trying to protect. They're so worried about competitive information going out, and it serves the organization well, but it doesn't serve the people well. And downstream, it's going to impact that organization, because it stifles innovation and creativity. So we need to put the tools in the hands of our staff and understand what is the best tool that's the safest. And then, we give them rules. I mean, our staff and, clinicians, we trust them with people's lives every day. So having tools that can be utilized inappropriately is everyday life for a clinician. So just putting some restrictions around on a policy as far as, what we can put in there and what we can't, so the biggest item is just defining the guide or the guardrails, I'll say.
Kolby, if I could add to that,
yeah.
In addition to getting people trained up and evaluated and doing those surveys, I mean, monitoring, are they using it?
Yeah.
Right. And that's a fairly easy metric, but you can encourage that usage by some success stories. Ben, share us a success story about how you used AI to solve this problem, and doing that publicly, because there's early adopters. Kolby's one of them. And then there's a gap, and then there's these later adopters, and that getting through that gap and getting their trust is important. So the success stories, how you used it, how you shouldn't use it, and where you had bad results, can be immensely helpful in getting that adoption, because there will be stalwarts who are not ready for it. Kolby, sounds like your dad probably eventually adopted it, but
yeah,
it's a big change.
Yeah, I think around the adoption piece too is understanding the why behind, anyone that is reluctant to embrace it. Sometimes it's just lack of familiarity, or lack of what it actually can do and can do safer. And I just think back last fall compared to right now in May, drastically different as far as the explainable AI, as they call it, where it demonstrates and shows you in real time what it's thinking about and what it's searching, and then it'll say trying again. And I've been able to write programs, computer programs, and in Python scripts to do tasky work that I would have never dreamed of like a year ago. And it's just consistent iteration back and forth, and it walks you right through and tells you what it's doing. So it also just teaches anyone that's trying to help a seventh grader with their math, or even someone with calculus like my daughter. I have no idea how to help her with her homework, but I can take a picture really well, and I can upload it and say, walk this through step by step as if I'm a 10th grader, so I dumb it down even a few more grades, and it'll walk through step by step and give explanations, along the way. And same thing, like, if there is, that's where you want to work with sensitive data. And even when you have data, it can be de-identified if you're looking at, a graph, or if that data is meaningless, if it's not tied to an organization. So you can still have it help you interpret items, or you can just take the data from a spreadsheet that, what it is. But the general public wouldn't know what it was if it went viral, right? But there's a lot of information out there that there's so much of this information it's not getting out there. The Microsoft, if you're on the pro version of the Microsoft Office 365 suite, they have a nice little green shield that is displayed when you're in Copilot, and that indicates that the data that you upload or that you put in there is not leaving the site. It's not leaving your organization. And that's comforting when you're referencing your guidelines and your policies and things like that. And so there's a lot of applications, and it's going to get better. I think by this time next year, we'll be able to monitor exactly what leaves and where, or if it's going to leave, it's going to prompt you. And that's why there's just no laws around this hardly, other than deep fakes, because it's just moving so fast, and there is a fear for over-regulating it and stifling innovation.
Yeah, no question. And, we know some, at the federal level and at the state level too, in Minnesota and beyond, there are, legislators are beginning to look at this, and how do you regulate it, and trying to work with industry is going to be really key there, I think. Well, I want to make sure that we've got some time here for our audience to ask some questions. We've got a couple coming in too, so appreciate that. Please feel free to put your other questions into that Q&A box there too. But we'll just kind of start here with this sort of look ahead to the future. Maybe this is even too long of a timeline, but to the both of you, where do you see AI having the most profound and lasting impact within healthcare? Thinking 5 to 10 years out, where do you see kind of the biggest operation or opportunities for success? Josh, I'll go to you first.
Yeah, I mentioned this a little bit earlier, but building that patient doctor, patient provider connection is, I think, a a real opportunity for everyone. It's great to have everything record, but a doctor sitting down with you and eliciting from someone who may be reluctant to talk openly about what they're experiencing, that's what our providers can do. It's unlikely that we're going to have an AI hologram doing the same thing, but that interpersonal communication, then picked up by Kolby's ambient AI, for example, can really take that and magnify the impact of that connection. So I see huge changes in that. I hope that that gets adopted by providers and is viewed as something that helps them get back to their roots and drive some of that satisfaction and reduce the burnout. The other thing, and I know it is controversial, is when it gets down to diagnoses. Those interconnections between somewhat disparate data points are just mentally, as humans, we can't work at that speed and that breadth, although some of us better than others. We're going to come to the point where the diagnoses coming out of there are by and large just accepted by the providers. And sometimes it will be wrong, but so are the providers. But I see a lot of probably some regulation around that. I see resistance to that that'll happen. And it's going to take a while to get through. But at some point, we're going to see that start converting, because there are AIs today that are certainly capable of it. They're only saying, have you looked at this, instead of it is this. So I'm watching that one very carefully, as I'm sure everybody on the call is. There's probably pros and cons. Well, there are pros and cons to it, but it's definitely an open area that we can take a look at, especially as we integrate data from disparate sources.
And Kolby, how about you? What is your what you're most excited about over the next, 5 to 10 years?
Yeah, over the next 5 to 10 years, obviously our aircraft in 10 years will probably be somewhat autonomous. And so now we might go from clinicians, thinking about flying to thinking about flying without someone in the front, So there's a lot of, those large electric UAVs that they're testing in these environments. And FedEx is doing, remotely flown planes out of New Mexico. There's a new company down there. It's all AI driven there's a pilot, obviously, to provide oversight. But I think what I'm most excited about is the increased access to consumer healthcare, where you don't have to go to a clinic. And, there's all these abilities through wearables and the growing technology that it's using, leveraging AI to predict or analyze or make correlations between data to make it meaningful and draw conclusions. And so a lot of people have wearable rings. I have a wearable ring, and it tells me how well I slept. It tells me my stress level. It tells me when I should stop drinking caffeine. And, I don't know any of that innately. And it just knows that based off of prolonged wearing of it, and it gets to know, your habits and your heart rate and your heart rate variability, and it can correlate that and determine that it's stress. And the other part is, there's stroke programs out there. There's AI stroke and stroke AI that providers can put the patient's face in front of the camera on the phone, and it'll walk them through the NIH stroke scale, and it determines it's basically taking the role of the provider, asking the questions and making the determinations. And there's even another one I have on my phone that it through a prolonged selfie, you sit there, it analyzes your face, and it gives you your heart rate, your blood pressure, your respiratory rate, your stress level, and even your pulse oximetry. And during COVID, that would have been a game changer, right? Everybody was going out and trying to figure out what their pulse or their oxygen level was. And then lastly is the interoperability. So as an EMS provider, we don't have, once we reach hospital doors, it's like a new day, right? We have data, hospital has data, and there's no really good connection, because the data that we collect for EMS agencies is much different and stratified much differently than healthcare data is. So there was a question here from Kelly about, using AI to synthesize data from multiple locations. And, that's a perfect example where we have what we call NEMSIS data, which is the National EMS Information System data. And then we have hospital data as it's in Epic, Cerner, or Meditech or whatever. And through AI, they can make the correlation between what's the equivalent to this data metric over here from NEMSIS as to what it is in the hospital. And right now, it's a very manual process to have an HL7 integration and map the fields to, from EMS to hospital and vice versa. And because of that, oftentimes they just say, you know what, we'll just take the PDF of your transport and put it in the chart. And, that becomes useful if someone reads it, but there's no ability to extract data elements from a PDF, right now. You can use AI to do that as well, but we can do better. And, the whole interoperability part has been a long going attempt since HIPAA high tech. And I think that'll take it to the next level where our data is much more accessible in a useful way. That's the one thing we have to protect too. We don't want to make it too accessible to just anyone.
Well, we've got a few really good questions coming in here, and I'll start with Kelly, who, by the way, says hi to you, Kolby. Kelly asks, are either of you familiar with applying AI to synthesize medical records, maybe even multiple EMRs to queue up data to a provider?
Yeah, I think that's kind of what I was alluding to is, if even for the EMS providers, right, if they were responding to an address and that address was already correlated in a clinic setting, and once you could verify that that patient was, they're properly identified, then you have access to their recent stay. What problems have they been doing? Because we rely on the patient as a historian, and sometimes they're a very poor historian. Sometimes they're unresponsive, and sometimes they have a poor historian as a spouse or family member or neighbor. And so just having access to that data that otherwise isn't readily available to the EMS clinician would be fantastic. And it's just what platform and how does it get accessed, and how do you verify the number of identifiable factors to access the right information?
Another question here. Will most AI agents be installed in devices that use CT, MRI, stethoscopes, or beyond?
Well, from a technology perspective, we'd like to avoid that so that we can do upgrades and things much easier. Getting somebody to plug in their stethoscope is probably an exercise in futility. However, there are some use cases, like an MRI was listed. An MRI creates massive amounts of data and images, and waiting for those to upload to the cloud is going to take far too long. So that level of AI on the edge is going to be much, much more important, especially since those images can't have any loss in fidelity. Every last pixel or detail in there matters. So I see a mix, obviously if we're going to implement AI into, say, an embedded device, that's going to have to happen there. You don't want your pacemaker to wait on a connection to the internet. That would not be healthy. But there's still opportunities to connect it and do the periodic updates or adjustments to its settings, for example. But yeah, I see majority not on the edge, but making exceptions where there are reasons, whether it's the size of the data or complexity or the immediacy of the need.
Okay. Timely question here. Being Nurses Week, which is this week, National Nurses Week, how can nurses be involved in implementing AI solutions in healthcare, and how can we ensure these solutions meet their needs? And if you have any successful examples, this person would love to hear them.
Yeah, well, being a nurse, it's, nurses do have probably the most important seat at the table, or should have, in anything AI patient care related, because they're the ones that are going to be using it more than anyone by sheer number of providers, right? And to get adoption, if you don't involve nurses or any staff member of any kind from the end user, like Josh said, you're just not going to have good adoption. But if you want someone to shoot holes and point out all the flaws up front versus finding it out downstream, I think at a health conference, I think the best thing I heard was build something with us, not for us. And that really resonated with me because, I've been guilty of that too. Like when you write a policy or you develop a clinical guideline or you recommend a piece of equipment, they're like, this isn't going to work in our setting. And it's like, well, we're very adaptive here, make it work, and that's what we have. I mean, we do just adapt and overcome, but it doesn't have to be that way. And several companies, almost every company, we encourage as our big network of nurses, we're very insistent that anyone in healthcare technology have a chief nursing officer or have a nursing executive leadership role to make sure that that basically plants the flag and basically demonstrate that this company acknowledges the importance of nurses and the role that they play, and get tap into the network of nurses all around the country, around the world, to get more input as well.
Another question goes kind of back to the metrics by which you measure success. So which approach do you suggest to measure the customer or user experience in a sensitive situation? Tools, frameworks, etc.
There's any number of tools you can use to measure and track where people are going on the website. We've all seen that, the creepy things that pop up in Facebook or other platforms where you swear they're listening. We always start with design led so that we can get at what is the actual problem we're trying to go after, and then set up the metrics against that. When you know the question or the solution, the problem that you're trying to solve, that's really where you go. And that might mean that you're tracking clicks. It might mean that you're tracking the lack of clicks or the gaps between clicks, or something else entirely. Kolby mentioned video analysis. I mean, there's videos out there that can actually have you just talk normally, and it'll fill out the PHQ-9 for you. So watching scores like that, watching utilization, this is, again, any number of tools could do those. What it really boils down to is what do you have at your fingertips? What do you need to augment from that measuring perspective? And most importantly, how are you building metrics that mean something? Can you make a decision based on it? Or is it just a vanity metric? Like I had 1 million people hit my website. Well, if none of them converted or used your material, it doesn't matter how many hit it.
Very true. Very true. We have just a couple of minutes left here. There's a question that came in asking about, probably Josh, to what you were mentioning earlier. What do you foresee as the difference between misdiagnosis by a human versus misdiagnosis by AI from a legal perspective? I might be asking you to get into the regulatory space a bit here.
Right. As a dime store lawyer here, I'd love to hear Kolby so I can spread the risk, but I think it's scale. I mean, people act very differently when a Tesla or Waymo hits something, even though they probably have much better track record. It becomes something that you can point at and blame without any personal accountability. Now, a doctor can probably see few thousand people, and AI can see millions. So if the error rate is a small percent, it gets magnified. And so your absolute value can become very, very big. So I don't know if I could predict legally, but I'd say that those are the things I think that will fuel legal pushes against AI.
Yeah, I agree. And it just becomes a target because it's an easy target for legal, probably. I would say it's more of an ethical challenge. And here's why. There's new methods to detect something like breast cancer that didn't exist, yesterday. So anyone that had a mammogram, 3 days ago, and now there's new technology today, what's the burden on the providers or the health system to reach back out to the ones when this technology did not exist? And reanalyze the studies, and that becomes an ethical burden really on the staff, and it's a real thing. And when you're just applying something to existing technology versus a new technology and a new product doing the study, it's so that's something we'll have to work through. But from legalities, there'll have to be legislation around this too, and I think it'll be around if the provider was not in the loop. That's probably going to generate more risk than not in the loop. But it's a thing. Like colonoscopies now, some of the providers, they have access to AI that puts a box around the polyps and highlights the polyps as they proceed through the colon, and it's pretty impressive to see that. So pretty much anyone, if you're a gamer, you could probably do a colonoscopy. It's just the future of everything now.
I do want to say thank you again to Josh and to Kolby for taking time with us here today and to share your insight and your expertise. I think this has been really valuable, and appreciate you answering questions here as well. I think this has been great. And again, thank you to MentorMate here for their support here of this webinar as well. Once again, Josh, Kolby, appreciate your time today. Thank you.